Hello everybody, myself Dr. Tahir Ansari. I am practicing as a general physician and diabetes in Howrah area, Life Care Nursing Home and associated few of the polyclinics nearby. Today I am about to discuss about a very vital topic about the role of the fiber-rich foods in supporting of the gut function. Everybody we are knowing that we are taking the foods, each and everything, whatever we think good for us. But what exactly kind of material foods are good for our gut health? Is today just a short discussion and a final discussion about it. So thank you for the opportunity for everybody to speak with you today and to let's share this topic today in this platform. My topic is that it directly affects everybody of us, whether they are the diabetes or they are non-diabetic hypertensive, any of the dyslipidemic patient or those who are elderly about more than 45 years of age, and those who are they don't have any issues but they are usually constipated like that. So fiber-rich foods helps in a lot of various ways that we have to include in that. In this modern world where everything is processed and convenience foods are very easily available in the market, we usually take whatever we like to eat, like what are the processed food, the canned foods, and everything like that. But in that thing, a lot of things what we exactly miss, we don't see the ingredients. Everything, a lot of things are the missing, especially the fiber things. We don't know the what we are consuming like this and just eating in our daily day-to-day basis. So it's just a dietary habit to about the critical important things about the food. Usually, which we usually overlook about all those ingredients. So I just want to highlight that why the fiber-rich foods are very much essential in maintaining our healthy guts and the normal lifestyles and even our cardiovascular systems and extensions our overall well-being. So what exactly is the dietary fiber? Dietary fibers are usually the indigestible parts of the plant foods, unlike fats, proteins, and carbs, which are the body usually break down and absorbs. But the fibers, as because it is just indigestible, usually passes through the intestines, stomachs, small intestines, colons, and the respective parts. Few of the things are absorbed in the respective parts, but the later they just moved on with the other parts of the foods and form the stools and pass through the body. Usually, it is classified into two main types. You can say the soluble and the insoluble fibers. Now, what exactly are these soluble fibers? In our day-to-day life, we usually just try to maintain the cholesterols and the hypertensive pressures and the glucose level. Now, these soluble fibers are very much helpful in this thing. It just form when we intake that kind of the fibers, it goes in the body, dissolves in the water and form a gel-like substances like that. This helps in lower the blood glucose level, actually maintaining the blood glucose levels and the cholesterol level. And where can you find these kind of fibers? You can take the example of the oats, the peas, the beans, usually the apples, and the citrus fruit. Any citrus fruit you can take that have got a lot of the fibers. That's why we usually recommend any diabetic or the dyslipidemic patient that not to take the fruit juice until and unless very much they are sick. Try to eat or consume the whole fruit, that is chew it properly, so that you are taking the juice. Apart from that, you are taking the exact amount of the fibers and all that, so that we can get the whole amount of the fibers along with the vitamin C's and other nutrients in the proper way. In the juice and the canned juice, it's everything is there, but there is no fiber because during the processing, they remove all the fibers just to maintain and to add some preservative. So try to chew the whole food. Now the second is the insoluble fibers. Now, this is actually to promote the material through your digestive system. Whatever we consume through our mouth, it goes in digestive system. So this helps to just a delivery system like that and increases the bulk stool so that it can be easily passed through the body. Like it can benefit for those who struggle with, as I said earlier, the constipated people or the irregular stool habits or the mucus stool they are having. So if they take this kind of insoluble fibers, so the bulk stool, all these IBS issues and constipation that can be without any medication that can be healed easily. So what are the components like the whole wheat can be like that, the whole wheat fibers, along with that you can say that the nuts, a lot of the nuts are there, the beans, the vegetables like the cauliflower, the green beans, and the potatoes. These are the good source of the insoluble fiber. These are the things which usually we use daily in our life. We sometimes miss the how much the volume, like how much gram we should take. Or sometimes we have taken once in a day, then we are forgot for the next 5 to 7 days because we move to other processed food like that. And a lot of the things available in the market, like is just ready to eat like that. Just take and just make it in the oven and just ready to eat. But we should avoid these kind of things like that. So these are only two types of the fibers like that. But how the fibers support the gut health? This is the very general question we usually have, that why we are focusing on much on the fibers like that. The fibers are the multiple roles in maintaining the healthy guts. There are few of the points that we'll explain today like that. Like first, the fiber increases the weight and size of the stool and it helps us sustain it. But when we are taking the fiber, we have to take a good amount of water also. Until and unless you don't have any cardiomyopathy or your EF is not very less. Apart from that thing, we have to take the good amount of the water with the fiber so that they both form the combination and size of the stool is bit increased and softens it. Now, bulky stool is easier to pass and reduce the chances of constipation. And if you have the loose and the watery stool, the fiber may also help to solidify the stool because it absorbs the water and add bulk to the stool. If you are you are a hemorrhoid patient and you have the recurrent episodes of like bleeding PR like that. So these kind of fibers if you will take, so this will increases the chances of the passing the stool very easily, and thus even the hemorrhoids or the colorectal cancer that can even be we can remove like that. Now, what are the feeds beneficial for the good bacteria? That's the second important topic like that. Our gut is a home for the trillions of bacteria. Actually, just figure is not known, but we can assume that trillions of bacteria. Collectively, we can, in short, we can say that it's a gut microbiota. Now, this microorganism plays a vital role in digestion, immune system, and even our mental health status. Fiber, particularly, you can say that soluble fiber serves as a prebiotic, means it provides the nourishment for these beneficial bacteria. When good bacteria ferment the fibers, now they produce the short chain fatty acids, which has been shown to improvise the gut health, reduce the inflammation of the intestines, and even protect against certain diseases. Like I said earlier, the colorectal cancer, even the hemorrhoids, a lot of the celiac diseases are like that because it forms a layerings in the intestines like wall like that. So this help the protect it and also act as a protective barrier like that. Is supports for the gut barrier function also. Now the gut barrier is a critical structure that separates the gut content from the rest of the body. It is composed of the tightly joined cells which prevent the harmful substances from leaking into the bloodstream. Like it acts as a gate like that, but it doesn't let the harmful bacteria go inside the bloodstream like that. Because they form the barrier. If we are taking a good amount of fibers, the barrier will be that much stronger and reducing the health of the reduces the risk of the leaky gut syndromes, a condition where the gut barrier become permeable. There is no permeability to everything that can enter. Now, a lot of the things that we consume that contain a lot of the toxins, a lot of the bacteria. Because of this barrier, it doesn't enter the bloodstreams like that. But if the barrier is very much weak or it's got some permeability like that, so easily it's entering the bloodstream and it can even lead to whatever the eat we are taking that can even lead to the sepsis or the GI sepsis, or it can even lead to a lot of the intestinal malfunctions like that, potentially leading to inflammation and disease. Diseases, any GI related disease, even the IBS or the celiac disease or the colorectal cancer, if this barrier is not there, so these conditions are very easily to happen like that. Now, fourth is it regulates the blood sugar level. It doesn't control. It's not like that if I'll take only the fibers of my sugar, we can control like that. The regulations is controlled. Whatever you are taking your or hyperlapsing agents or the insulin, whatever according to your body, something like that. So this, if you take the complete amount of the fibers, so this will help you to regulate the balance like that. Because if you are passing the stool regularly, you are taking consuming the foods regularly, you are taking normal amount of the water, so your acid-base mechanism of the whole body is totally maintained like that. To regulate the blood sugar levels, particularly the soluble fibers are very much helpful. It can slow the absorption of the sugar. Whatever we consume, it forms into the glucose. The glucose is converted into the energy. Now, these, the transport medium, it helps to regulate the maintain. The fibers have got a very vital role in that. This can lead particularly benefit the patient with the diabetes, like I said earlier, and then a high diet in the fiber also reduces the risk of developing the type 2 diabetes by improving insulin sensitivity. Those who are pre-diabetic or those who are just in the borderline diabetes like that, or those who have a good family history of diabetes, both the parents are diabetic, or they have a siblings of diabetes like that, but that patient is particularly not suffering from that. So they should particularly resist with these kind of things to avoid non-fiber things like that and any kind of the canned food like that. So this, if they take the soluble fibers in a good amount of money, it's around 25 to 30 grams per day. Or both fibers we can include in that. So that will improve the sensitivity. So your body will definitely, it will cope up with whatever you are thinking. So they will try to maintain the body glucose level like that. And those who are obese patient and they are just doesn't know how to do the weight management like that, the fibers have got important role in that also. Like high fiber foods, which we are feeling than the low fiber foods, is we should unlikely to less eat and stay satisfied longer. This can help with the weight management, which is another factor by maintaining a healthy gut. If your gut is healthy, your mental status is healthy, then your lifestyle is also will be healthy like that. It's everything is just interrelated with that. Excessive weight has been linked to imbalance in the gut bacteria. So keeping a healthy weight is another way the fiber will support for a good health. You maintain your weight, you maintain the daily dietary habit, and by this kind of few of the things adding in your food habit, everything will be balanced. So ultimately, it will take bit of the time, but definitely your weight is going to reduce like that. Now, fiber-rich food we include in our diet. This is the most that we have. This is the timeline for this discussion. Is that the fiber-rich food to be included in diet every day, even around 20 to 25 grams per day. Maximum you can do to 30 grams also, depending upon your diet, your exercise, and your work habit like that. Now, to achieve this benefit, it is essential to incorporate a variety of fiber-rich foods in the diet. So, some of the excellent source of dietary fibers in our daily day-to-day life, like is, say for example, in the fruits we can have apples. Any apple is really green or the red, and the pears, the oranges, and the berries. Like I said earlier, we have to consume the whole fruit, not only the juices. We cannot just take from the market that we are having the juices, the multi-grain juices, the multi-fruit juices and all that. We have to consume the whole fruit. We have to chew it properly. In the vegetables, one should at least include even the broccoli, the carrot, the juices, the sprouts. If you're not having one of these, but try to increase the other thing in that amount so that everything will be balanced like that. The most important is the legumes because we usually consume a daily, but we don't know what to take like that. Any of the you pick up any lentils, the chickpeas, and the black beans, they are very high rich in the fiber, so you can consume any of these at least once in a day like that. Usually in the breakfast or in the afternoon, we what kind of rice we should consume, what wheat product. White flours usually we avoid, but whole wheat products, the brown rice and the oats, they are very good in that, so you can easily consume that. A lot of the nuts and the seeds like the almonds, you can take the chia seeds, the sunflower seeds, the watermelon seeds, the flax seeds. These seeds are very much very beneficial of taking this thing. They're very easily available in the any of the market. Just soak in it for a few hours in the water and just consume it like that. You can add a bit of honey if you want like that. It is important to note that the increasing your fiber intake, you should do so gradually because sudden increase can lead to abdominal bloating, nausea, vomiting, dizziness. So usually people do like that. They start taking suddenly and bloating is started and they leave everything. So you have to take once in a day for 5 to 7 days, then gradually increase. Take your time for a month like that. First, slowly, silently increase. And plenty of water because to help that fiber to digest easily, to form the bolus fluid, we have to drink the plenty of water and the fibers work best when we absorb water. Make this as it make this stool soft and bulky like that. So good amount of water, good amount of the fiber that will directly indirectly help the gut bacteria like that. And if the gut bacteria and the abdominal part is very much okay, if you feel very confident like that, your mental status will be happy. So everything is just interrelated with that. Like so, in short, in the conclusion, is that the fiber-rich food are not just very beneficial; they're essential for maintaining a healthy gut. From promoting the regular bowel habits to feeding the beneficial gut bacteria to supporting the gut barrier and regulating the blood sugar level, fiber plays a multi-faceted roles in the digestive health. So by incorporating a variety of fiber-rich foods in the diet, you can support not only on your gut but also your overall health and the well-being. So thank you for your time and hope this information was enough to discuss the fiber-rich food like that. I encourage you to prioritize the fiber in your daily lifestyle and daily diet like that. Thank you.